The project for universal nutrition and health coverage through sustainable system for nutrition improvement is a public-private partnership initiative that comprises of 3 or 4 institutions. The main institution is TAF, the Ajinomoto Foundation, and then NEC, Sysmex, the World Food Program, and the public sector Ghana Health Service.
In 2018, Ghana Health Service, led by the Family Health Division, has support from the Japanese government to review the maternal and child health record book. And it has come with some challenges. Notable amongst them is the poor completion of the book, looking at the diversity of infants when it comes to their nutrition, high anemia rates. We are looking at how they are completing the nutrition counseling table, and then also late referrals or delay in referrals. So it became something that the division was discussing, and then the same Japanese government came on board and then brought in this new project, which is the Ghana Nutrition Improvement Project. The Ajinomoto Foundation has contributed its bit very well. Ajinomoto was looking at the social and behavior change aspects of this project, and they supported in the capacity building of almost 200 staff for the various batches of training that we did.
When we welcome our clients, we take their weight and their height if they are due, and then we record them in their MHRB book, and then after that we register them in our registration books. After that we enter their data onto the NEC app, and then when they are settled, we give a health talk. This health talk contains a lot, and mostly on the nutrition of the kids and their well-being. This is where we chip in the Cocoa Plus. How to introduce the Cocoa Plus to the children or babies from 6 months old to probably 5 years old.
This product has essential micronutrients as well as amino acids that are very helpful in the nutritional development of young children in Ghana here. And as part of this whole intervention that is to improve the nutritional status of children, we couldn't have done much without using Cocoa Plus as part of it. So the collaboration with Cocoa Plus is an essential one, and it is very much valued in this partnership.
Our product can support for the prevention, addressing malnutrition of infants. But by collaborating together, so we can support to not only children, infants, but also preschool children and elementary school children, and also adolescent people, and also adults. So we can cover whole people by collaboration and making synergy.
We have many varieties of food here in the counseling. When the mother comes, we show them what we eat in the house, what we can get. That's the ones they can easily afford. That's the biggest one we have here. So the mother can see, I have this, I have this. So when I go home, I can easily practice with this for the kids to eat.
I have a baby. It's me who baby ni ye. No mo catch me say, money nsu, money aduane for 6 months. Me di ni nyina so. It's me ya 6 months ni ye. Na no mo ma nutrition for. E be try say 6 months go ye no. It's me aduane bia. It's me mani die huo. E be mani banku a emre by we won na ye mmemme ma utimi de ma no. Obetimi ma fufuo. Ana obetimi so ma ni koko. Na koko no de ma na. O so we di Cocoa Plus efra. Obetimi de ma na nuhu aduane bi a obedi efa tinku ana yemfa Cocoa Plus emfra eti egusu ye ne saa amesese wanya na amant
me banna ni mudro ni wo fom ena me ne ba we yi no mo say me to Cocoa Plus na me fa na aduane if you cry enkwan cry minti cocoa plus ni bingu na me fa man no nti say after maka chem say me di so aya man say den ban imu be drama me.
It greatly improved attendance because the mothers come in excited, waiting to hear what will be done and then participate in our cooking demonstrations.
Now we are starting in one district, Ejisu, but so in future we expand, scaling up. Of course, my product, the Cocoa Plus protein micronutrient powder, is now working together with Ghana Health Service in 152 districts, around 60% of fall in Ghana. So we have already scaling up. But for inviting other companies, so they also can scale up and make synergy from Ejisu to Ghana.
NEC provide a lot of the technology into this project. With the proliferation of mobile technologies now, we were able to provide a mobile application or an application that resides on a mobile device. Inherent to a mobile device is its ability to function in the field. Many people have them these days, so it's easier for these to be used within a project such as this to gather antenatal care type of data, which is collected by nurses on the ground, and specifically this information. The use of the application will provide nutritional guidance to the nurses on the ground as well as to the patients in need.
The app is able to remind them of missed clients or defaulters, so they find it easy to track those who do not come.
We counsel them using the tablet because it summarizes the information for us, so we are able to give the accurate information to them for them to adhere to it, and we play the videos to them as well. You know, we have videos on it, so they are able to adhere to the information which was given to them because they look at what is on it and it's played in tree, so they understand it very well and they are able to. So it has helped to reduce the prevalence rate of anemia in a government hospital.
This innovative collaborative project uses XN31 from Sysmex to do testing within 1 minute. It gives us a wide spectrum of analysis to inform decision making on the health status of our clients.
With this project, one of the core areas has been capacity building. So we have trained the medical laboratory scientists to use the analyzers well. We have also trained the doctors and the physician assistants to optimize the results that we get from the analyzers.
When it comes to diagnosing malaria, if we are using the gold standard, which is the microscopy, it actually relies heavily on the expertise of the person performing the test. But this one, we have an analyzer that is giving us the parasites that is present, the species, it's giving us the stage and actually giving us the count as well.
Before this project, I believe that most of the healthcare centers were testing patients for hemoglobin and malaria. And through this project, we are able to diagnose the type of anemia that you have and make the right intervention to be sure that your anemia is treated. Today, we still have close to 60% of Ghanaians who are anemic, and through this technology, we have found out that the right diagnosis of anemia helps doctors to get the right treatment, and we believe that with time, people with anemia will reduce drastically in Ghana.
I think this is revolutionary because mothers are going to be able to spend lesser hours in the hospital. We will be very efficient in our health service delivery. And the vision is that if this is really scaled up across the country, then the returns on investment will be huge, both on the side of the healthcare providers, but also on the part of mothers and those who access these services.
The Ajinomoto Foundation is pursuing the brighter future because if stunting is addressed through such product, the body development well and the brain development as well. So they can maximize their potential.
It has been so relaxing working with staff because we've learned a lot from staff, and I'm very sure they've also learned a lot from us. And looking into the future, we will have to continue to work with them.
To ensure that this initiative is sustained and scaled up, we have chosen technologies that are scalable and can easily adapt to growing needs of the healthcare system. Investments have been made into building the capacity of local staff, that is the IT staff in the service, to independently manage and maintain the technology.
And I think when we are able to even generate more evidence from this and share at global platforms, then it's going to really serve as a model that can really be replicated elsewhere.
Over the past decade, the government and people of Japan have consistently funded WFP programs which support the government of Ghana to improve nutrition, especially among the most vulnerable. Thanks to their generosity, the current project, which we are jointly undertaking with the Ghana Health Service, the Ajinomoto Foundation, Cocoa Plus Foundation, NEC, and Sysmex Corporation, have combined Japanese technology and best practices to significantly improve health and nutrition in the Ejisu district.
Aha!